Right. Hi, Miss. Really for taking the time to join me today. My name is Sandro, first year medical technology student, and I'll be interviewing as part of our PMLS one subject. The goal of this interview is to learn more about your life, real life experiences, responsibilities, and insights as a registered medical technologist. Before we start, may I confirm that I have your permission to record this interview for editing purposes?
Yes.
Alright, so let's begin. Let's talk about your background and career path. To start, what made you choose medical technology as a career?
So I first chose medical technology as a career when I was in high school. Because it is around high school when your teachers start to encourage you to think about what you want, what course you want to take in college. We didn't have senior high before. We did take strands, I guess, like something in STEM or HUMS or ABM. Instead, excuse me, instead it was just think about what course you want to take before you took the NDI, just the national exam. So I considered going into medicine first. So from there, I asked my parents that their friends were doctors what would be the best course at the free medical board, and they all suggested that. As for the college, they all suggested the Golden Brothers, which is at the time more pinaga known more or less na good place to start if you want to go to CIM, which is like the top school for medicine. So
So you graduated
I
at
graduated from high school. I went to Velas. I graduated from Velas, then took my board exam right after. And then I did go to Med for a while at CUC, but due to the pandemic, especially, I decided to stop and just start working. So that's how I became a medical technologist in 2020, 2021. That's when I formally started working, even though I graduated in 2015 and got my board, got my license in 2016.
16. Alright, that's quite very inspiring. How did you become a religious technology? Uh, can you share a bit about your journey?
So, in order to become a registered medical technologist, you have to take a 4-year course in Bachelor of Science of Medical Technology. Your last year, your fourth year, is your internship year where you have to comply with, I think it's already 10 to 12 months of hospital duty or community duty, depending on your school, as long as you have the required hours. So, after you pass your final exams and you graduate, you still have to take the board exam in order to get your license to be a practicing medical analyst. So what I did after, because at the time our board was scheduled in September and we graduated by May, I had around 3 months of full review at the review center before I took the board exam with all of my batchmates, and more or less all of us passed after. Like, we had like around 300 students, and I think majority of us passed. Not really 100% because I think, you know how someone from another batch will take with your batch?
Yeah.
They don't want to fail. Yeah.
That's really great. And can you tell me more about your first experience working at clinical laboratory? How was it like stepping into that environment for the first time?
So, when you come from studying almost exclusively for your entire life, more than 10 years, you learn right away that what is theoretical and what you learn is different from what you put into practice in the lab. I started at a freestanding laboratory that was as with an HMO, which is your health maintenance organization.
Which
Meaning,
Asian hospice?
MaxiCare. So I was hired by Singapore Diagnostics in 2021, and for 6 months I worked with them at the MaxiCare branch in Manila. Then, not just in medical technology, do you learn a lot of different things that you put into practice versus what you study, but you also learn about how you interact with patients. That's the most important lesson I learned in my 6 months there. Because, especially with insurance, patients who are insured, they have this expectation of, because you're paying for something like convenience, they're paying for convenience, you have to treat them with extra care because they're paying a lot convenience versus coming to the hospital. So that was my first job. It was busier than a hospital role. I can say, because a freestanding lab like Singapore Diagnostics doesn't only handle the HMO is assigned. They also get
Is
walk-ins. They also get send in tests from different clinics. So we got from other freestanding clinics that didn't necessarily have the machines needed for the tests that they wanted to run. So they would send it to like their mother laboratory, which was Singapore Diagnostics. We also got tests to be done by certain companies. Like for example, a certain company would want all their employees to undergo certain blood tests to indicate their liver health, their kidney health, and they would send in all these bulk tubes to be tested before they sent back the results. So I will say that if you are in a freestanding lab, it is infinitely more busy than being in a hospital lab. But again, it depends on
compared to government hospitals or government
if a
labs.
government. I think I wasn't able to work in a government hospital, but I did my internship at Salto. And I think that the government hospitals are definitely the busiest of all. Really.
During your time at Massacre, how many mentors were you, I mean, was assigned to in a daily basis?
So ideally, I think what Massacre wanted with their lab at the time was they wanted to be 24/7, but this was during the pandemic, so their schedule was from 6 a.m. to 10 p.m. And at that time, a lot of people have resigned, maybe because of the pandemic or maybe because they were able to go abroad. So I think will be around 4 or 5 in one shift.
Gotcha.
Yeah, so for example, since I will be the one who would be there from 6 p.m. to 3 p.m. and my job would be to receive the patients for their early morning extraction and swabbing throughout the day. There will be another person assigned to run the test access, to register them and run them with the different machines. There's also a different person to validate the results. So what we mean by validation is they will check the results that the machine would send to the computer, and based on their judgment, their professional judgment, they will decide whether or not it required to be run again, reflective release it as is. Then the laboratory supervisor will be there, the managers, but it was basically around 4 or 5 medtechs in a whole day. So
How about for the pathologist? How many?
the pathologist assigned to that lab, the freestanding lab, he didn't stay there on a day-to-day basis. Rather, he would come by and pick up slides for reading, like pap smears. That's what he was there for. So we prepared the pap smears and give them to him, or he would come by to pick them up. He couldn't stay there exclusively. Unlike, let's say, here in the hospital where the chief pathologist is here every morning.
Okay. Thank you so much for sharing that experience. Let's talk about your roles and responsibilities, Miss Donna. And then now I'm curious about your day-to-day work. What does a typical day look like for you as a med tech?
So my current role here is a section head. So I'm the head of this department, the histopathology department. I would say that my daily day looks different from a rotating med tech. So there will be the people you will see more often downstairs, getting confirmation. So for them, I'll start with them. So for a normal med tech, when you've gone into work, you first tap them into, attendance. Then if you're a floater or a person who gets blood from the different patients, both inpatient, outpatient, walk-ins, you first enter into a huddle or an endorsement session with the previous shift. So the night shift is from 11 p.m. to 7 a.m. So right before 7, the AM shift and night shift would be together in order to endorse any things that didn't that were to finish during the previous shift or are scheduled for the AM shift that the night shift received as a request. So this will be the time where you will talk about, okay, this patient needs to be extracted at this time. This patient needs a re-extraction because their blood was hemolyzed. This patient is still undergoing fasting and will be taken at this time, or this doctor requested this test to be run on this patient sample, which was taken last night, like things like that. That's the very important thing to do at the end of the previous shift and at the start of the next shift. That's for the rotating methods. Then as the day goes on, they receive requests to draw blood and to perform different testing. So if you're just a rotating medtech, you get the blood, you check it in, And if you're assigned to help at the reception, you can register the patients, the records, release results if you don't have interns. Basic blood typing, like forward typing, is done by the person who is tracking the blood, clocking time, daily time. All the face-to-face point of care testing is done by the regular techs. Then you go into a more specialized area, like, for example, histopath and microbiology are more specialized because you have to be assigned here to work here every day. So if you're assigned here, you can't necessarily go back downstairs to work and come back here. If someone does rotate downstairs, it wouldn't be the section head, but rather my subordinates. I have two subordinates, and every other shift, so every 2 weeks, they can be assigned here or they're assigned downstairs. So what we do here is we focus on. I would like to segue into the next question, which is which library section I handle. So I'll answer the question as one. So I handle this pathology. We deal with pathology biopsies, pap smears, fine needle aspiration biopsies, cell blocks in cytology, immunohistochemical staining, special histo stains. So what I do here is when I first come in, I check that the tissue processing is completed because tissue processing takes 14 hours. So it starts at 4 p.m. the previous day and ends at 7 a.m. the next working day, which is the start of my shift. I work from 7 a.m. to 3 p.m. So after checking that the tissue has been processed, I next bring it to the embedding machine in order to be embedded so we can create the what we call FFPE, which is formalin fixed paraffin embedded tissue blocks. So these are your samples submitted by the patients for biopsy. After embedding them, we section them into very thin sections, around 3 to 5 micrometers, which are then placed onto glass slides. We heat fix the slides, then adhere the slides, proceed with the routine staining, which is hematoxylin and staining. After preparing the slides, including mounting them so they're secure, putting a cover slip on and labeling them, we submit them to the resident pathologist for preliminary reading. So that is the bulk of the work in a day. But like I mentioned earlier, we also have pap smears. We tend to stain those by bulk, just so that we can get the most out of our stains. For other special stains, we also tend to do them by bulk. So for immunohistochemical staining, we do it every Wednesday. So basically, I don't work as closely with the patients as a normal medic would. I don't face the patients directly. Rather, I work with other doctors who call in for certain questions about biopsies, or but I work the most with the pathologist, the resident pathologist and the consultants in terms of how the slides are, how they can process the quality of our work, and what we can improve. And of course, I also like their requests.
You mentioned earlier about rotating medtech and then a specialized medtech. How rotating medtech will reach to that level?
So when you're first hired, at least in this hospital, when you're first hired, you have a 6-month probationary period. So in those 6 months, you're often rotated first in the reception area. That's where you practice and learn how to receive patients, how to register them in the system. You familiarize yourselves with the different tests and how to charge them in the patient's account. Then, of course, you practice phlebotomy. That's the number one thing. You practice phlebotomy and knowing what kind of specimen is acceptable for running. And by specimen, I mean specimen submitted by other departments like doctors or nurses. So in cases for microbiology, you learn there, okay, is this sample acceptable by our department standards? Is this lacking anything? Things like that. So you start there for 6 months. In those 6 months, your senior medics will gauge and sort of assess your work ethic and how well you learned. And from time to time, the chief medtech who will assign schedules will rotate you to the more basic departments. So sometimes you can rotate for a while in clinical microscopy, which is also our pre-analytical area. Sometimes then after that, we would get assigned to a specialized department after 6 months. Usually this happens when the chief medtech gauges that, okay, you're ready to be assigned to a special department so you can learn the specific tasks for that certain department. So at the second floor, we have hematology, clinical microscopy, and clinical chemistry and immunoserology. Those four departments, you have a higher chance of still being able to rotate downstairs as a floater and still go back there from time to time, depending on how the schedule is. But because, again, histopathology and microbiology are a bit more specialized, wherein there's just quite a lot to do and learn. Once you get here, again, it's harder to move back down unless you've really stayed here for a long time. My current partner, Ariana, she was working here straight for since April and April or May until now because she's still learning the ropes of this department. But once after my assessment and the chief medic's assessment, she was also able to go back downstairs and rotate with as well.
Thank you so much for sharing them. And lastly, what challenges do you commonly face in your practice during your rotating days?
I think the rotating is the fast-paced learning. So again, like I mentioned earlier, what you learn in school, or even as an intern, is far different from what you can actually do as an intern because you have to always consider the patient factor or just the people factor in general. And how do you reconcile like a doctor has a specific request but your SOP dictates otherwise? So how do you handle that situation? Because handling people as much as you handle your samples is the most important. I also think that one of the problems that new medics can face is they tend to marattle sila. Like the first, remember, kind of example, the most important step as a medic is was the most cardinal rule not to always label. Identify your patient, always label. Sometimes they can forget to properly label or they pre-label their tubes and that isn't correct either. They can sometimes forget to inform the patient to do this or they got a sample they shouldn't have then because you're so new at it, you tend to forget what you've learned and you're still learning again. So I think the challenge is to remain long but still absorb everything at a faster pace. And another challenge I think is the physical aspect where it's tiring. It's very tiring because you're getting used to a schedule where your sleeping schedule can change at any time. You could be 7 to 3 one day, you could be 3 to 11 the next day, and then you're at night shift 11 to 3. It can really disrupt your sleeping schedule, and a lot of people have a hard time adjusting or coping with it. Other than that, mostly it's just literal on-the-job training, especially if your internship didn't really allow you to be hands-on as you could be. So I think that's the basic challenge as a rotating med tech. Dealing with people, dealing with their new tasks, and trying to assimilate it all into your new way of life.
How about for the patients who are afraid of needles or afraid of getting extracted? How do you handle those kind of cases?
So you can't, it's always important to validate or put value in the patient's feelings because you might not think it's a big deal, it's just a needle, but for them, it's something that they're genuinely afraid of. And emotion, fear, things like that, it can affect how you extract blood. It could, for the stress could add, the added stress could actually make the patient somehow hemorrhage, especially if they struggle a lot. So I think what's important is you empathize with the patient, you give value to their feelings, but also explain to them that this test is necessary, like it was requested by the doctor, it's necessary. But if worst comes to worst, if they really do not want to get their blood extracted, which can happen from time to time, like they're a difficult draw and they don't want a second try, third try, what you can do na lang, you not force them, but you can instead think of it, okay, can I have your signature that you refuse to proceed with this test because you're in pain, it's too hard. Then, if you're a difficult draw, as a new medtech, you're obliged more or less to at least try once, twice, maybe even thrice. But if it's a really hard struggle and you don't want the patient to suffer, that's when you can call for help. The important thing is, as a new medic, you have to try. You can't just pass difficult cases to your senior because you are also afraid. So it's like emphasize, but also do your best to help them feel better about it.
Thank you so much for that advice, And move on to professional practice and ethics. In the laboratory, accuracy and ethics are really important. How do you ensure the accuracy and reliability of the lab results in your work?
So let's start with the very beginning, which is the patients themselves. So the first step in ensuring accuracy and reliability is identify the right patient. When a patient approaches,
Uh-huh.
you always ask them, "Ma'am, sir, what is your complete name and birth date?" You don't prompt them with, "Are you, let's say, Jose Carlos?" You can't do that because it's just easy to just do that.
So you get
You have to let them verbalize their complete name and birth date. After getting blood, you don't really go tubes. You write the name on the tube in front of the patient. Once you're able to have them identify themselves again. So you get the blood, you put them in the tubes, and as for labeling, after you visit the label, ma'am, can you please repeat your name and birthday just to confirm?
so after extraction.
So there are 2 points of checking before and after extraction, before you label the tube. And the tube itself was labeled twice. So your handwritten label, so the complete name, age and sex,
Uh-huh.
the date and time of extraction, and your initials as the medtech who did the draw. And we have our barcoded label, which indicate what tests the tube is specifically for. So there are 2 points of checking there. We check that in downstairs, and once there's an upstairs the pre-analytical area, another medic will again double check the tubes and labels and the test to see if everything coincides. So that's one step in ensuring accuracy and reliability. Next is the actual testing stage, which is the analytical stage. All the machines used for testing, since they're automated here, have to undergo regular calibration and quality control. So these are reagents we use to ensure that the values of the way your machine runs stays within the normal values set for that machine. So with every new bottle of reagent, you always have to run a calibrator and the quality control. Depending on the department, on what their policies are, you have to run these QCs, could be daily or weekly, it really depends. What's important is it has to be run in order to ensure the accuracy and sensitivity of the machine. Any variation, we can then talk to our engineers to check if the machine's running well.
So all the rotating medtechs can do and operate
If they're assigned and taught in that particular department, depending again on the schedule of when QCs are run, so it could be at the night shift. I think it's in the night shift for our chemistry department. They will run the QCs at night, so by the time it's the AM shift and the bulk of the patients have arrived or the samples have arrived, everything can run smoothly without delay. Because you can expect less samples at night than you would expect in the morning. So if you're assigned into that, if it's your assignment in that particular shift, it's considered part of your JD to run the UCs. So that's the second step in providing accuracy and ensuring reliability. The last is the post-analytical, which is the releasing of our results. So it's always important to double check the patient's name is assigned to a patient bill. Like from time to time, you've seen for example, the patient is initially registered at the admitting or at the ER, and for some reason there's a mistake. Later on, they change the patient's details in the system, but we aren't notified of that. It just changes in the system. The next thing to do is once printing results, always double check that nothing has changed in the system. At least by the time, if you can check the names again, we can catch any typographical errors and change that to the accurate name. Again, when releasing results to the patient themselves, we're very strict about that. Particularly, we have to release the results directly to the patient themselves, if not the patient, then to their authorized representative with a authorization letter. It's very strict that way, basically.
Thank you so much. Can you share an example of an ethical situation you encounter in the lab and how you handle it?
So I think what comes to mind when you ask help at this is data privacy. Because we're in one of the major hospitals here in Japan, and Cebu is only that big. You can't deny that you will eventually receive a sample of someone you may know or someone you're familiar with. It is your duty as a healthcare worker to uphold your moral, morality, and ethics to not share this kind of results, especially when even as just chismes or whatever. Like example, the best example I can use is HIV. That's a very delicate topic these days. And let's say you recognize someone coming in for HIV testing, you're duty bound to not share any hint of this person being here, of what tests they're taking, or even the result. That is an ethical situation. I think most people eventually will face in the lab. Not knowing not to share results as just even if you don't like that person or you really want to. Even if you're just worried, you could have good intentions like I know this person, oh my god, I want to share that they have cancer or whatever. It is not your right, it is not your place, and it's important to just really remain as a neutral party and do your best as is without adding to the stress of it.
Lastly, what values guide you as a medical technologist in your profession? I think the important thing is altruism. So, all in all, healthcare workers are in a field of service. We're here, we do these things in the service of other people. So I think an important value to remember is that no matter how tired we can get or how stressful things can be, a lot of what we do is to help make others feel better. They need it. So, in moments where you find yourself encountering difficult patients, difficult, significant others, it's important to really remember that these people are here under high levels of stress. They're having probably the worst day of their life, the tests are making them anxious, or they're just annoyed that maybe they could be sick, they don't want to be sick, they're in denial. So remembering that we're in a field of service is, I think, a good value to uphold against the political because it sort of comforts you that I'm doing this to help someone else. It doesn't take much to be a bit kinder and more empathetic. Another value that I think is important as a medical pathologist is always be curious about your work. Have healthy curiosity about the subjects you're studying, about how you can apply here. I reread my notes for histopathology when I first got assigned here. And only when I put it into practice did I appreciate what I studied in third year. You may not relate to it as a student, but later on when you're working, for me, I'm curious about things. I like to know why. Learning about it gives me a new perspective and a healthier appreciation to do a better job since I understand why I need to do things a certain way. So I guess that sort of curiosity improves my quality of work and also fulfills my role here as a mentor. Thank you for sharing, Musda. Let's move to biosafety and risk management. Okay, let's talk about the in a laboratory. How do you practice biosafety in your workplace? So everyone here is required to have wear PPE, so personal protective equipment. So usually includes a lab gown, gloves, sometimes goggles, and definitely a mask, especially when handling chemicals, as we do here in my department. For the floaters or people who encounter patients, the hair is required to be really tied up, held back with a hairnet, the gloves, the mask, and then always change your gloves between patients. We also practice a thing called the universal precaution, which is to treat every sample from a patient as potentially hazardous. It's better to pursue it is positive than not treat it as it's negative. Yeah. Always practicing with precaution, hand washing. Those are the things we practice mostly here. When you mentioned about voters, how is it different from rotating methods? Rotating methods depends. If you could be assigned to chemistry, then voters are exclusively assigned to extract blood from patients. So they're the ones who actually go out to the different wards and stations. So you'd be assigned to inpatients and you go to the patient's bedside to get their blood. You could be assigned to the ER, you go down to the ER and triage. Or you could just be assigned to the laboratory itself for walk-in patients. So that's your main role to receive and handle patients. So you would get the most exposure to different patients. Whereas rotating methods depends on the department you were taught in. So you favorite clinical, chemistry, hematology, and etc. Thanks. Thank you for clarifying that comparison. And have you ever experienced a lot of accident or incident If so, how was it handled?
So when I first was assigned here in Section A practice with a merit room, my brittle blades are very, very sharp in order to be able to cut tissue sections at that thin of a thickness. Just like when you're still practicing, you can, if you're not used to it, you tend to get it more clumsy with it. So I got an accident. I had a cut on my finger. It was bleeding a lot because it's very sharp. So what we did is we went to the ER because the OPD was still closed at the time. The doctors there assessed my hand. It didn't need stitches, but they did give me a shot since it was not on the wall. After that, the head nurse of our OSHA, which is Occupational Safety and Hazard Administration, she interviewed me to just get the full incident of how I got my wound, just for record-keeping purposes.
And what advice can you give to students like us about laboratory safety? Always, before entering the lab, always read up on the laboratory's safety practices and policies. For sure, every laboratory, even your school laboratory, has that. Make it a habit to follow those policies. And I would say just be a bit more careful and conscious about how you move in the lab. Don't be clumsy, be a bit more aware of your surroundings just to avoid different accidents. Just being a bit extra careful so you don't hurt yourself more with the people around you. Thanks so much for that advice, Miss Donna. And let's move to career-based science and advice. On a macro note, what do you enjoy most about being a medical technologist? I enjoy, I like learning. So I enjoy just learning more about the different departments. Even if it's not the one I'm assigned in, I can ask another department, like, okay, well, so what does this test mean? What does this do? What does this machine do? And I like knowing things about that. I like, oh, I remember this in college, so that's how it's applied. Or I like talking to dermatologists, talking about the different diagnoses they see based on tissues. Like when we do the gross examination of tissue, they're able to see things like this look like cancer. So I can ask, well, what makes it look like cancer? So for me, I enjoy having my academic curiosity satisfied. I like having a routine in my work. So I don't necessarily find it boring to do the same thing every day because there's always something interesting or new to learn if you look for it. I find satisfaction in giving good results. Like when I ask for feedback regarding the tissue process or the stains, when they tell me it's good or it's doing well, I like hearing that means that I'm doing it well. And most especially, I like having good people to work with. When you're able to get along well with your colleagues on a professional level, maybe even a little more on a personal level, it makes the stress worth it. Like everything else can be stressful, but as long as you're with the right people who work, you can work well with, it's all good. All right. Thank you so much for sharing that, Ms. Donna. And what important skills or habits do you think that students should start developing early on? So since you're in your academic era, I would suggest just really start solidifying what would be the best study schedule or study method for you. As early as your first year, figure out what works for you. It may not be the most traditional way of learning. You could learn better from watching videos of other people explaining or etc. It really depends. You may learn better early in the morning rather than late at night. Like I would just suggest learning that as early as your first year so that when you reach the higher years and eventually enroll to your majors, you won't feel as stressed trying to figure out and learn the best way you can because at least okay, I know how to learn this way. So this may be a new subject that I haven't encountered before, but at least I know how to learn and I'll make it work for me. You don't have to follow what someone else is doing. Just have to figure out what works for you. Second thing is, I truly believe that you should develop discipline and structure. Discipline and structure, but also be flexible enough to adapt when you know that something isn't working for you. Because medtech isn't just like understanding things; it really is memorizing a lot of things and learning a lot of things. So
having the discipline to learn that instead of doing something else or scrolling on your phone, it's really important. You can find some subjects really boring because you can't relate. And most of the time, it talks about machines which are outdated. Like, for example, chemistry, the spectrophotometer isn't really used these days. It's more of an academic point of learning. It's still important to really just push the envelope and discipline yourself to learn because it will be off later when you take your exams and the like exams. And lastly, I think students should just start being more less clumsy, I think. There's a lot of new methods tend to be a bit more clumsy or they don't pay as much attention to detail as they think. So like I mentioned earlier, not labeling properly, forgetting things, those are things that it is better to just kind of do away with before you get to work. But make sure you're able to pay attention to detail and really learn as you go rather than making mistakes. Actually, make your mistakes when you're younger so that when you're already working, you more or less have an idea of what to do.
Right. Thank you so much for that advice. And during your uh, study era, what study habits can you suggest or will you do before
So,
that was very happy for you?
my schedule before was different because our curriculum was different. Like all of our majors were compressed into third year. We didn't have like histopathology, histology or parasitology in second year, which is what I think is changed in the curriculum. So my schedule would be 7 to 7, 8 to 8, and that would consist of like let's say 7 to 7, like 7 or 7:30. That's the long lecture exam, followed by lecture, maybe a laboratory session in the morning. After lunch, you do a practical exam or another long exam, then another lecture or depending on the schedule. So it's literally 12 hours in a day. What I found best work for me was that as soon as the lessons were done, I get home, I would have dinner and take a bath and sleep. Because I would study better when it was at dawn. So I wake up maybe 1 or 2, and from straight na pumata, I'd be studying straight because one of the effective ways of learning is spaced repetition. So when you learn something on day one, you review it again on day two, you review it properly. Then you give it some time, like maybe skip a day or two, then you review that topic again. The more you go back to the topic and actively use your mind to retrieve that information, the better it is stored in your long-term memory. That's one way to learn. Another is to the way you study should be active studying, not just passive, not just reading and highlighting your notes. You have to find a way to actively trigger your brain to search for that information. So one good way is to quiz yourself or create flashcards. Like I know people use Anki for memorization because it makes your brain work to retrieve the information that you read. So I think those things really work well. But again, it really depends on the subject and how it's taught to you. But all in all, like I said, it depends on how you learn as a person and how well it's taught you. And if you feel like the way you're being taught isn't enough, there's nothing stopping you from asking for further clarification or seeking outlining sources of learning. Because essentially, it's just similar. It just depends on what book you get it from.
Thank you so much for that advice and sharing those your experiences before. And finally, what advice would you give to first years medical tech students like us who are just beginning our journey?
Enjoy your younger years. Honestly, like you're gonna get stressed anyway. So I didn't say that you should really, develop your study habits, develop discipline, but don't make it like a be all end all point. Just enjoy your first year and second year while you still have the time. Join extracurriculars, because that's how you eventually learn to have work-life balance. It can all be work, it can all be play. So don't forget about enjoy both. Then really listen to your body. If your body is telling you to rest, then you need to rest. You're not gonna learn if your body's running on 4 hours of sleep. Like when I was in bed, I was running on 4 hours of sleep, and half of the time I couldn't remember what I read the day before. So really listen to your body. Know when to rest and when to discipline yourself to put in the extra effort. And just really enjoy yourselves. In fact, develop a healthy curiosity. Like Mentioning at times can be boring, but find something in it that can be interesting to you. Because when you're interested in something, you can become curious about it, and it makes the learning less boring. So, enjoy yourself, but don't forget that you're in this course for a reason. So know the reason why you're in this course and keep that reason in mind so you don't stop where you stop.
Alright, thank you so much for sharing your time and experiences. I really enjoyed learning a lot from your insights and stories. They're giving a clearer picture of what it's like to be a math professional. And I think that wraps up our interview. Once again, thank you so much and have a great day, Miss Donna. And what's your complete name again, Miss Donna?
Jordana A. Caban.
And what's your position? And
I'm the second head for the histopathology department in Perpetual Southern Hospital, Clinical Laboratory.
all right, thank you so much, Miss Donna.
Thank you. Here.